Yes. Yes. Where is the question? Right. So if you have read and understood, considering
Okay. I'll enter the room, introduce myself. Good morning. I'm Dr. Nadeem, one of the surgical candidate. May I please confirm your name and age?
Yes. Tiffany, 55 years old.
Okay, thank you. So I'll also wash my hand, and then I'll need a pillow to place the hand of the patient, both hands on it,
Yes.
and
Yes.
proper exposure till the elbow at least.
Yes.
Both hands.
Good.
So I'll just be in looking and then feeling and doing some special tests. So if you have any pain anywhere, just let me know. And if any discomfort during the examination, you can stop me. Is that okay?
Yes.
Fine. So I will expose the hands. First, the one which is of the complaint.
Yes.
I'll inspect the palmar aspect, dorsal aspect for any scars, erythema, swelling, pulsations, any lumps, bumps. Then also on the forearm and arm, dorsal and volar aspect both, and also the elbow.
Muscle wasting and even the nail changes.
Thenar and hypothenar eminence.
Very good. Yes.
All things. And any fistula, scar marks previously. After that, I'll also look for ocular nodes, macular rash, any splinting hemorrhages in the nails, or clubbing. After that, I'll tell you that if you feel any pain while touching with my hand, then you can just tell me. So I'll feel for palmar aspect, then the dorsal aspect, also palpating each metacarpals and phalanges quickly, and then also the forearm and elbow to look for any nodules, any painful ocular nodes, or any Janus lesions. After that, I'll do the passive movements of the each finger joint.
You'll check for the temperature, and then you'll do the radial and ulnar pulses.
Yes. Tenderness, pulses, and temperature.
And squeeze test as well.
At once. Yes.
At
Tenderness, temperature, and pulse checked at once. Sorry, my bad.
And what is the bimanual examination of the wrist? How would you do that?
I'll do from lateral and medial press the metacarpal heads to see if there is pain both hands. So I have looked for tenderness,
carpal bones, DIP, PIP,
carpal, phalanges, and
snuff box,
metacarpal snuff box.
Then
after
ulnar.
That, ulna, yes, ulna, and also the radius, the elbow.
Yes, ulnar border of the elbow. Yes.
Yes. After that, I'll do all the passive movements of each joint of the wrist joint, also lateral deviation and medial deviation of the wrist, along with the metacarpals and interphalanx joints, passive movements. After that, I'll check for flexor digitorum superficialis by blocking the neighboring phalanges, and for digitorum profundus by blocking the interphalangeal joints for each phalanx, each finger. After that, I'll tell the patient to do extension with the wrist while I will be resisting. After that, I'll tell the patient to open the fingers against resistance. After that, closing the fingers with resistance. Then doing the same movements, transpalmar flexion, abduction, adduction, and pincer movements of the thumb and also holding my finger in the palm, squeezing my finger. Also, after that, I'll tell him that I'll touch the cotton or neurotip on the hand. So she will close the eyes, and after touching the sternum or forehead, I'll tell that you will feel like this. So I'll ask for snub box for radial nerve, for little finger ulnar nerve, and the index finger for median nerve, and lateral 1/3 of the hand, and 3.5 fingers for median nerve, and medial half, and 1.5 fingers for the ulnar nerve. After that, I'll look for extension of the wrist by the prayer sign and reverse prayer sign, and also force flexion of the these joints while patient is trying to open it, and I'll forcefully flex it, and also doing the tenal test by tapping on the palmar aspect of the wrist joint at the flexor retinaculum. And if there is any abnormal tingling sensations in the thumb area or medial half of the hand, then it will be positive tenal test. After that,
yes. What other special test would you do?
Yes, I'll also do for Fromen's test to see for adductor polysis by holding paper between the thumb and the index finger without flexing the thumb, and also looking for paper holding between the fingers, other fingers. And I think I'm done with the exam. After this, I'll thank the patient. We'll look for elbow. And
can you present your examination now, please?
I have examined the patient who has supposedly, if I say that tenal test was positive, and tenal test was positive. So this was the only positive thing. The sensory and motor signs were normal, except for the tingling sensation on tenal test. Based on this, my provisional diagnosis is carpal tunnel syndrome.
Okay, what other condition would you consider? So what are the differential diagnoses?
Okay, others may be arthritis, rheumatoid arthritis, like trauma in past.
It could even be diabetic neuropathy, etc.
Tendinitis, neuropathic pain.
Yes. So what investigations would you ask for to confirm your diagnosis?
Okay, X-ray of the wrist joint just to rule out any fractures, and baseline examination including uric acid levels. After that, we'll do the CTS conduction test.
Yes, what is it called?
EMG test. EMG test and
electromyography, no abbreviation.
And electromyographic. Also doing MRI of the neck to rule out any radiculopathy in the.
What labs are important in this scenario? Which lab tests would you ask for?
Nerve conduction test, NTS.
Laboratory.
Laboratory.
Thyroid function test and
rheumatoid factors. Diabetes, HbA1c.
So what are the treatment options that can be offered to the patient?
Okay, it will be conservative, like resting, exercise, physiotherapy, and painkillers and compressions. And also, if no improvement, then minimal invasive surgeries or open decompression of the tunnel.
Okay, good. So what have you missed? Today I'm going to ask you.
Inspection, palpation.
Yes.
I think that's,
once I stopped you and I told you, and in the second part you were telling yourself, I did not interrupt you. So even at the end, when I asked you to present your case, and what was something that you missed? Very basic, very, very basic. And you know that as well, because you're always in a hurry. So you forgot. You forgot.
I don't know. I mean,
yes. Once you're examining a joint, so you always at the end say, if time would have allowed me, I would have completed my examination by examining the elbow, because that is the joint before. And what else?
Yes, elbow and neck, shoulder joint and neck joints. I think I mentioned that, but yes, you're right.
No, elbow and neurovascular examination of both upper limbs.
Yes,
but,
I did not
at the
say
end,
neurovascular examination. Yes, you're right.
when you were examining, you mentioned elbow, but once you were telling me that you examined this female and what was the conditions she presented with, then you did not mention, because there you have to mention. It carries 1 mark. So this you have to remember. Another thing, when you were doing movements, so which movements did you check first? If I'm not wrong, did you ask the patient to do passive movements first? Or did you
I did passive first to see if there is any tenderness, and after that active.
Yes. If little request or little suggestion or little advice, when patient comes with pain or tenderness, then it is always best to ask the patient to show the active movements first, because then you'll have an idea how much range patient has when patient is doing active movements. You'll know how easy or comfortable patient is with those active movements. Then when you'll perform the passive movements, because passive movements are performed by you, not by the patient itself. So then you'll be careful not to flex too much, not to extend too much, not to cause pain to the patient. That's why always remember to ask the patient to do active movements first, and then do the passive movements yourself later. One more thing. Yes, remember please. And then you forgot to check the radial pulse here. I think you took yes above. So, and the anti-interosseous. You had to check that, and Fallon's test. And then
Fallon's test, I forgot to name it. It was the force flexion.
Yes, Fallon's I was asking you to mention it, but then you remembered comments, because at that time you haven't even had mentioned that as well. So you talked about the comment sign. So comparatively, it's good improvement, but little request not to be in a hurry.